Something most of us do every week or every month now, without even thinking, is ordering a trip from a rideshare driver, such as Uber or Lyft, like the gentleman depicted here. But how many of us actually stop to think about the working conditions and specifically the health and safety challenges your driver faces as they get you from point A to point B? Well, that is exactly what we are doing here with this project, funded by the John Monash Foundation. We are Brett Shannon
and Johnathon Ehsani, two injury prevention researchers and previous John Monash scholars, collaborating to specifically understand the employment and health factors of rideshare drivers in the United States and Australia. In the first quarter of 2021, Uber had almost 20 million trips a day worldwide, and Lyft reported 18.7 million. This is a workforce that deserves our attention. Prior to applying for the Monash funding, we did some pilot research and conducted a first-of-a-kind survey in a sample of US rideshare drivers last year. We found that a third of rideshare drivers had been in a crash while they were working. Crashes are just one of the many hazards faced by this population, and not only do they impact the driver's health, but they can leave them unemployed for a period of time and with large medical bills. In our survey, we also saw high rates of risky driving behaviors like drowsy driving, which is likely the result of their long hours and irregular work schedules.
More broadly, we know that motor vehicle crashes are a leading cause of work-related deaths in many countries, including the United States and Australia. Unlike similar drivers, such as commercial cargo drivers, railway workers, or passenger drivers, the rideshare workforce faces unique risks because they are considered independent contractors, and they have non-standard work arrangements that limit drivers' access to training, workplace benefits from workers' compensation, and also paid sick leave.
Rideshare drivers fall into a gap, making them a hard-to-reach and mostly invisible workforce. Because of this precarious employment arrangement, currently we have very little information on the types of crashes rideshare drivers have, including those that are non-fatal but serious and those that do result in injuries and fatalities. Using this John Monash Foundation funding, we're going to deploy a validated survey in Australia and the United States with a broad long-term goal to support the development of interventions and programs that will improve the occupational health and safety of rideshare drivers.
We want to understand drivers' physical injuries, drivers' mental health concerns, drivers' abuse on the job, their working conditions and employment arrangements, so that we can inform policy development related to the occupational health and safety of rideshare drivers and be constructive both through direct effects on compliance by passengers, rideshare drivers and rideshare companies, and through their indirect influence in communicating occupational safety expectations to these groups and other stakeholders. So next time you ride in a rideshare, take a moment to think about how these drivers are handling the many challenges they face while they get you from point A to point B.